Hey Sally, Dr. Katie's going to be in just a moment to explain what the American Heartworm Society 3 injection protocol and the FDA approved 2 injection protocol consist of. Okay?
Okay, sounds
All
good.
right.
Hi, I'm Dr. Katie.
I'm Sally. Nice to meet you.
Nice to meet you. So we got Moose's heartworm test results back and he is heartworm positive. So we're gonna go ahead and try to move forward with treatment if that was okay with you.
Okay, what happens if we don't do treatment today?
So with heartworm, we have a couple options. There's only one drug that's FDA approved for heartworm. It's called melarsoline dihydrochloride, and it's the only adulticide drug that the FDA has approved. And we're treating for obviously heartworm disease. We want to get all of those heartworms out of Moose's body. So there's basically 2 known regimens to treat heartworms. We've got the 2-dose regimen and a 3-dose regimen. The 3-dose is what's kind of promoted with the American Heartworm Society. So basically the drug, we have a couple brand names. We've got Imidacide and Diroban. Have you heard of those?
No, I haven't heard of those.
Okay, well we can kind of walk through like what those drugs are. So both of those are just kind of the name brand of the melarsoline dihydrochloride. So that's what you're gonna see like on the statements when we like print you off like what happened with Moose today. So basically we would calculate a dose of 2.5 mg per kg for Moose, and we would inject into his epaxial muscles, kind of like right on his back by his lumbar vertebrae.
Okay.
And all of this is coming from the 2018 American Heartworm Society. All of their information is online, so that's where we got all of that from. We have also the 2-dose regimen, which is not super promoted, but that's also the one that's okayed by the FDA. So if you go to the FDA's website, they have the 2-dose regimen kind of listed, but the American Heartworm Society has kind of adopted the 3-dose as being a little bit more effective. That 2-dose regimen is the same exact thing, minus the 1st dose. So he would get, if we're doing a 3-dose regimen, he would get his 1st dose of the adulticide injected into his back, and then 1 month later, he will get 2 doses 24 hours apart. So one at the first 24, and then at the end of that 24 hours, he'll get a 2nd dose. With the 2-dose regimen, we're removing that 1st one. So we only get the one between 24 hours. So we can kind of proceed with all of that stuff if you would like.
Yeah.
All right, so we're gonna compare the outcome performance for the treatment protocols that Dr. Katie went through with the client with respect to the percentage of dogs cleared of the infection and the percentage of worms killed.
So first, I wanted to talk about the protocol endorsed by the American Heartworm Society, the 3-dose protocol. It treats class 3 heartworm disease and kills 98% of worms according to the principles of treatment of canine heartworm disease. Article by Charles Thomas Nelson, published in Today's Veterinary Practice in the March-April 2015 edition. I also looked into the results of a study published about the outcome of a heartworm treatment protocol in dogs presenting to Louisiana State University from 2008 to 2011, which was a 50-case study written by Elizabeth Maxwell and colleagues, published in Veterinary Parasitology in 2014. And that one looked a little more closely and noticed that using the 3-dose melarsoline protocol, there was a 51.7% reduction in the adult worm burden after the 1st injection, and a 99% reduction following completion of all 3 doses of the protocol. It's also important to note, though, that these data reflect the percentage of worms killed in the groups of dogs, not the percentage of dogs cleared of worms.
When it comes to the Food and Drug Administration, as already mentioned, they go with the 2-injection protocol. From the research that has been done on this, it shows that about 90% of the heartworms are killed when using this protocol. However, there's some mixed reviews out on what the actual reduction of worm burden is. So while this is approved by the Food and Drug Administration, it's not nearly as successful as the 3-dose protocol approved by the American Heartworm Society.
The other thing that I wanted to mention that isn't related directly to the worm burden is just that in both of those studies that I mentioned, they added the caveat that there is a decrease in respiratory complications and mortality rates when doxycycline is included in the protocol. So I just wanted to add that.
Right, Caitlin and Michaela, kind of walk me through the post-treatment side effects for the American Heartworm Society 3 injection protocol.
So the following information comes from the article Top 5 Complications During and After Heartworm Treatment, written by Dr. Jennifer Sidley, as well as some of the American Heartworm Society guidelines for heartworm disease. Continuing to monitor and limit levels of activity is extremely important following treatment. It is one of the most significant causes of post-adulticidal complications. Pre-treatment workups, including thoracic radiographs, are helpful for evaluating potential complications that may occur after adulticide administration. However, this is not definitive, as some infected patients do not show clinical symptoms or have significant radiographic changes. Many dogs treated with melarsoline show a worsening of thoracic radiographs and a rise in pulmonary pressure after completing injections. Pulmonary embolism is a concern as the worms die following treatment. Patients may experience injection site reactions or discomfort following treatment. Clinical signs are most commonly seen 10 to 21 days after injections. With that being said, the majority of recoveries are uneventful. Always remember to thoroughly discuss the potential side effects and post-treatment regimen with the owner prior to beginning treatments.
So when dogs are treated with the FDA's 2-injection protocol, they receive their first adulticide injection and then the second injection 24 hours later. This means that all of the worms are being killed acutely with this administration. With the American Heartworm Society's 3-injection protocol, the first dose is given, and then that kills half of the worms. The second dose is given 30 days later, with the third dose following 24 hours after that. That kills the remaining worms. One study by Keratin in 2014 found that dogs receiving the FDA's 2-injection protocol had the highest D-dimer concentrations. This indicates the presence of more worms and more frequent severe thromboembolic processes compared to dogs receiving the 3-injection protocol. Pulmonary thromboembolism is a possible consequence during the death of the worms that could cause death of the patient. There was also no improvement in the UPC values of dogs receiving the 2-injection protocol. The study also states that the acute death of all worms under the FDA 2-injection protocol could result in more detrimental effects to renal function due to the release of antigenic particles.